10 scientifically proven health benefits of mindfulness meditation. Get better sleep. Anyone who suffered the lingering mental and physical effects of a poor night's sleep on a regular basis can appreciate this all-important benefit from mindfulness meditation: better sleep. In fact, research with older adults diagnosed with sleep disturbances found that the practice resulted in significant short-term improvement in sleep quality by remediating sleep problems. The researchers noted this improvement apparently carried over to reducing sleep-related daytime impairment that has implications for quality of life. Make progress towards your weight loss goals. If you struggled with yo-yo fluctuations in weight and tried many fad diets to weight loss crazes, it might be motivating to learn that mindfulness meditation has been shown to be a good strategy to support weight loss goals. A clinical study involving overweight and obese women found that mindfulness intervention for stress eating, while not designed to induce total weight loss, did stabilize weight among those who were obese. Researchers also found that greater frequency of eating meals mindfully was slightly related to weight loss, noting that minimally these techniques may support weight maintenance efforts and actual weight loss might occur for those participants who eat a high proportion of meals mindfully. A survey of the American Psychological Association licensed psychologists by Consumer Reports found that mindfulness, along with cognitive therapy and problem solving, are excellent or good weight loss strategies. That's because the focus of dieters should be more on the role of their emotions play in the weight management rather than solely on exercise and calorie control or eating less. Lower your stress levels. It is a fast-paced society we live in, which contributes to everyday stress. Learning how to control or minimize the effects of stress on body and mind is important in overall health and well-being. So it is refreshing to know that a review of 47 clinical trials found that mindfulness meditation programs show small improvements in stress and distress and the mental health component of health-related quality of life. Another study found that focusing on the present through the practice of mindfulness can reduce levels of cortisol, the stress hormone. Decrease loneliness in seniors. Getting older has its challenges, yet relationships can be deeply satisfying and personally enriching. For many older adults, however, loneliness due to the loss of a spouse or partner can be made worse when there are concurrent medical or psychological conditions or issues to deal with. One study found that an 8-week mindfulness-based stress reduction program reduces loneliness and related pro-inflammatory gene expression in older adults. Banish temporary negative feelings. Sitting all day at a desk or computer is not good for your overall health and well-being. A study assessing college students' daily waking movement-based behaviors found less momentary negative effects of movement with mindfulness in mind and suggested that incorporating mindfulness into daily movement may lead to better overall health benefits. Improve attention. Researchers found that brief meditation training for 4 days can lead to enhanced ability to sustain attention. Other improvements from brief meditation training included working memory, executive functioning, reductions in anxiety and fatigue, and increased mindfulness. Manage chronic pain. Millions of people suffer with chronic pain, some following an accident that leaves them with a long-term medical condition, some as a result of post-traumatic stress syndrome after serious injury during combat development, others due to diagnosis with cancer. Managing chronic pain in a healthier way is the focus of much current research. Indeed, the search for clinical trials and alternatives to medication to help patients cope with chronic pain continues to gain momentum. Mindfulness-based stress reduction, a therapy that combines mindfulness meditation and yoga, has been found to result in significant improvements in pain, anxiety, well-being, and ability to participate in daily activities. Help prevent depression relapse. Mindfulness-based cognitive therapy, according to a growing body of research, may prove beneficial in preventing depression relapse. A particular strength of the mind-body technique is how it shows participants how to disengage from the kind of highly dysfunctional and deeply felt thoughts that accompany depression. A 2011 study found that a mindfulness-based cognitive therapy is an effective intervention for depression relapse in patients with at least 3 prior episodes of major depressive disorders. Another study found that mindfulness-based cognitive therapy provided significant relapse protection for participants with a history of childhood trauma that left them with increased vulnerability for depression. Reduce anxiety. Feeling anxious? Researchers have found that even a single session of mindfulness meditation can result in reduced anxiety. For the study, researchers focused on the effects of a single session of mindfulness meditation on participants with high levels of anxiety but normal blood pressure. They found measurable improvements in anxiety following the single mindfulness meditation session and further anxiety reduction 1 week later. Researchers suggested that a single mindfulness session may help to reduce cardiovascular risk in those with moderate anxiety. Increase brain gray matter. Along with the well-documented benefits of mindfulness meditation, another surprising finding of the mind-body practice is that it appears to increase gray matter in the brain. A controlled longitudinal study investigated pre- and post changes to gray matter that could be attributed to participation in mindfulness-based stress reduction. Researchers found that increases in gray matter concentration occurred in the left hippocampus, the posterior cingulate cortex, and the cerebellum. These are the regions involved in memory and learning processes, regulation of emotion, self-referential processing, and taking perspective.